Hello everyone, I am Dr. Anuj Dash, a general as well as a laparoscopic surgeon, and I am welcoming you all to this brand new video. And this video is another method of palpation, which is known as fluctuation. In my previous video, I have discussed on some other techniques of palpation of a swelling, like sleeping sign for lipoma, sign of indentation for sebaceous cyst, and compressibility test for hemangioma. As I always state that I would request that you guys should go through the videos thoroughly, and if you like and if you find that the videos are helpful, please encourage me by commenting as well as subscribing my channel. So let's begin our journey. The disclaimer which I always give. So fluctuation actually it confirms presence of a fluid in a swelling, and that fluid may be clear fluid, like it may be water, or it may be hydrocele like amber color fluid, or it may be cerebrospinal fluid also, as well as the fluid can be mixed fluid like blood or pus or lymph as well. Now, what is the principle behind this fluctuation test? The principle lies in the Pascal's law, which states that if we exert pressure in a fluid containing swelling or anything, the pressure will be transmitted equally in all direction, equally and all direction. So, if we want to clinically assess the fluctuation test, first of all, the swelling must be fixed, and that's the way by which we fix the swelling. And you need to know about the displacing finger and watching finger. Like this is the swelling, okay, and I have fixed the swelling with this index and thumb. The index of both fingers, these two fingers, are used to displace actually. Like we will press over that by that index finger, and we'll feel with the thumb. Like if we press with the left index, the right thumb will watch or will feel. That's why these index fingers are known as displacing finger, and those thumbs are known as watching finger. So first of all, the swelling must be fixed, and that is displacing and watching fingers. No. Another principle is the examination should be carried out in two planes, and the second one should be at the right angles to the first. Like look at that picture and look at that picture. Okay, here if we want to draw angles, so at that picture, that examination is done in that direction, and here the examination is done in that upward direction. So the angle between these two are 90-degree, or which we call a right angle. So the examination should be carried out in two planes, and the second one should be at right angles to the first, mind it. Now, there are many methods of assessing or palpating the fluctuation test, and that depends upon the size of the swelling. If the size is very small, less than 1 centimeter or 1 centimeter, then we do one finger test, as we don't have the place to enter other fingers, and that is called the Pigeon test. And how it is done? That is done by simply pressing first center, then at the peripheries. So that is known as the Pigeon test. Center, then peripheries. Clear? I think clear. Then we will go for a two finger test when the swelling will be bit larger. Okay, more than 1 centimeter or 2 centimeter. In that cases, we can use the two fingers, and one is palpating or displacing finger, another one is watching fingers. Like here, the right index is now displacing and left index is watching. Okay, and we have to examine at right angles. So never forget to examine at right angles of the previous one. So that is the way how we do the two finger test. Now, if the swelling is that way that we can use three fingers, then we go for a three finger test. And here the left finger, left index and left middle finger. Okay, These two are used as the display watching finger. Okay, and the right index. The right index is coming and that is used as the displaying finger. And here also the pressing and the displacing. And here also you need to examine at right angles of the previous one. Okay. Now the swelling is very large and we need to use all the fingers like we do in the clubbing. First of all, we are fixing with the thumb and the ring finger, and we are using the index finger to displace and the thumb for the watchment. Okay, so that's how we do the fluctuation test in large swelling with using all our fingers. So these are the four principles we need to mention. Now, how to fix? We have seen that we are fixing the swelling, but how to fix the swelling is large. And the way of fixing is we use, look at the video, there is a swelling and the little fingers of my hand, both hands are fixing the lowest border. And the ring finger of my both hands are fixing the superior border. And middle finger is not necessary. And the displacing fingers are the index fingers and the watching fingers are the thumb. So we can fix with the use of little finger and with the use of ring finger. Okay, I think that technique you need to follow and that will be very helpful if you practice. If you don't practice it, that will be very hazy in your examination. Sometimes the swelling like a hydrocele can be very large and the enormous size doesn't allow you to fix by your hands. Okay, in that cases, we ask the patients to hold their testicles or their swelling and fix it. So in case of very large swelling, the patients will do your job by fixing the swelling. So I think that's all for today, and I'm thanking you for watching the video. And if you like it, then you go for the subscription, and your subscription will encourage my journey. So thank you very much. Thank you for watching. Thank you.